Here's another one for you. This is a fairly simple yes/no. Are the FTF curriculum materials available in Spanish?
Yes.
They are. Good. And how would people get those?
They would just contact us through our website, www.ire.org. Now, when I say the materials, that may not be every single thing that you find on the website might not be available in Spanish, but certainly the introductory materials, such as we have here, and all of our curricula that we use the curricula that we use are adapted for English language learners.
Okay, thank you. And if Dr. Allen can get back on, I think she's been bumped out, she can help participate in answering this question. But Dr. Connell, can you tell us how the First Things First was funded? Is it at a district level? I mean, where did the funding sources?
Historically, it's been there have been three sources of funding for the not-for-profit. One is we have received federal research grants from the Department of Education. Thank you, Department of Education. Two major longitudinal research grants that have included funds for the schools to participate in the professional development and technical assistance that we bring. So there has been funding from the federal government that is interested in generating the evaluations. The data that I just showed you are from federally funded evaluations that were done of the Kansas City, Kansas work, as well as of work in Houston, Texas. So federal. We also received funding from private foundations. So the initial funding in Kansas City, Kansas was from the Kauffman Foundation, which is a foundation based in Kansas City, Kansas. And between the years, in the early years of 2000 to 2005, we received extensive funding from the Gates Foundation to develop, for example, the vital signs instrument was developed using funding from the Gates Foundation. And then we also receive funding directly from districts. So districts will contract with us directly to provide supports. The funding that in Madison, in Michigan, is provided by the General Motors Foundation, is funding the work there, and the United Way. So we receive funding from community-based or state-based philanthropic organizations, national philanthropic, the federal government, as well as from districts themselves contracting with us.
That's great. Sounds like you have a great network of funding established there. Dr. Gracia, we have more interest in making the connection between disparities and Health People 2020, and someone has noted that one of the overarching goals of Healthy People 2020 is to eliminate disparities and achieve health equity. Can you give our participants some guidance or insight of how a community would make the connection or address the health equities disparities issue in the context of social determinants?
Well, I think one of the key things that certainly you see when you talk about the social determinants of health is understanding that it's multi-sector. It's today certainly with the focus being on education, but also looking at income, at employment and occupation, looking at the physical environment with regards to factors like environmental quality in neighborhoods. So all of those things can really come into play as contributors when you talk about social determinants of health and then the health and well-being of communities. So that is recognized certainly not only within Healthy People 2020, but other initiatives that the Department of Health and Human Services has underway, like the National Prevention Strategy that was called for under the Affordable Care Act, really to help Americans live healthier lives. And one of the strategic directions in the National Prevention Strategy is to eliminate health disparities. There is also a strategic direction to help have healthier and safe community environments. What communities certainly can do, as they look to the determinants of health and in focusing on their communities, certainly there's information within Healthy People 2020 in the website and some information on data that communities can use to help tailor their plans and programs to their specific needs. But there are also resources such as the Center for Disease Control's Promoting Health Equity publication that helps communities really look at and tailor and address the social determinants Determinants of Health. There are resources like the Community Health Status Indicators Project that's managed by the Health Resources and Services Administration to give data as well as some mapping capabilities on health indicators in communities. There's also information from funds like the Commonwealth Fund's Health Data System, providing information from national to state and local level, specifically on child health, for example, too, where you can basically get a better picture of health in the communities. So this type of information can be used to really help to look at who important partners are as communities are working to design specific strategies and programs and plans within their local communities that will address the disparities, as well as both health disparities, but also some of the socioeconomic disparities that may exist in communities that are contributing to the health disparities.
Great, thank you. Now we have some more questions coming in, and unfortunately I think this might be the last one we have time for it. And first, Susan, are you on?
Sarah, I'm here. Yep.
Oh, yeah, okay. Well, let me go back to one. There's one. Folks are really, we have a lot for Department of Education. People want to know, what does the Department of Education have available in terms of resources for implementing a program like First Things First, and what other resources and funding activities or opportunities are there?
Thank you. As a follow-up to both speakers that went just before me, I would like to encourage you to think of the Department of Education as a partner at the federal level. We have information available, we have funding available for implementing programs and for building capacity to implement programs. So when we were talking about the First Things First, some schools, LEAs, some states can access funds for implementing programs with demonstrated effectiveness, and you can find those resources in the form of discretionary grants. Sometimes they're targeted at data collection, longitudinal studies, and demonstrating effectiveness. Sometimes they're targeted at building the capacity of staff, so they provide opportunities, as was mentioned earlier, for staff to participate in training, to receive coaching and materials needed to implement the program. And some programs have funding available to build partnerships. So really the funds are focused on opportunities for school personnel to partner with community agencies and organizations to build a seamless service delivery system, something like we've heard mentioned today as well. So if you're looking for funding or information on implementing programs, the Department of Education has a lot of resources to provide. And I'd be happy to follow up if you have questions about specifics. We also have, I just wanted to mention the National High School Center, which provides information. That's by checking out their website, you can learn about federally funded initiatives that impact high schools and opportunities for funding. They have information available about related topics, healthcare centers, literacy, I've heard mentioned today, dropping out, restructuring schools, so if you're interested in learning more about a particular area, and also about building the continuity, a comprehensive systems-wide change. So that information, the National High School Center, you can check out their website, www.betterhighschools.org. And another resource I wanted to mention to you, because we're talking about social determinants, is the Technical Assistance Center on Positive Behavioral Interventions and Supports. The PBIS Center helps schools build capacity to put into place programming such as First Things First. So another great resource for building social, emotional, behavioral skills, and also thinking about how to begin to implement programming such as First Things First.